Hi, how's everybody doing? This is Dr. Cory Murray, physical therapist at Physio, and today I wanted to show you a nice technique that we use in our clinic for anyone that's suffering from some shoulder pain, rotator cuff pain. And this technique utilizes these great FAKTR tools that we have here. These tools are amazing because they have double beveled edges, which make it so that as we're utilizing this technique, it doesn't get too painful or grabby on the patient. So Katie here's been having some pain in her shoulder, so I'm just going to go ahead and show you a nice technique that we utilize to try to help her get to feeling better. So what I'm going to have her do is go ahead and turn facing the wall over here, and then I'm going to kind of find the scapula. Now, a lot of times people think that when you're doing this treatment that you have to have the skin exposed, and that's not necessarily true. You can actually do this treatment over the top of clothes. It's perfectly okay. When you're going over the top of the clothes, you don't have to worry about using any of the emollients such as cocoa butter, things along those lines. Basically, the shirt is going to kind of serve as that protectant from burning her skin. So this is actually nice for somebody that's maybe uncomfortable with kind of showing bare skin, things along those lines. We can do this with a shirt on. So I just go ahead and palpate along, kind of find the scapula here, and then I'm going to move in over onto the infraspinatus. And then what I'm going to do is just some nice kind of testing. I'm just going back and forth here, just kind of feeling how her tissues are feeling, if I can feel any grabbing or catching. As I do that, I find a little bit there, and I kind of work back and forth. Nice and quick. This is going to help kind of bring in blood flow, break up any kind of fibrotic tissues that are kind of building up and getting everything moving good again. So after I've kind of worked around on that for a second, what I can actually have her do now is start moving her arm using those rotator cuff, external rotators. So what she's going to do is just bring her arm out and bringing it back in, and then I'm going to get on the same spot and just work this over. So now what's happening is I'm kind of working those tissues as they're actually moving, helping to further break up anything that might be locking them down, causing them to adhere, and increasing that range of motion. A lot of times when we're doing this technique, you might actually find it that their external rotation starts to improve as they've kind of moved along and you're working through the shoulder blade there. So this is a technique that we use in our clinic for anybody that's been suffering from some shoulder pain. So if you currently are experiencing shoulder pain, feel free to visit our website at www.profysiomt.com and have a great rest of your day.